Have you ever wondered why we hiccup? Let's face it, hiccups are a peculiar phenomenon that we've all experienced. They can strike at any moment, interrupting our conversations, meals, or even our quiet moments of relaxation. But what exactly are they? Why do they occur? These are questions that many of us have pondered, yet few truly understand the answers. So, grab your curiosity hats and prepare for a journey into the human body. Let's dive into the fascinating world of hiccups to uncover why they happen. Hiccups are a result of an involuntary contraction of your diaphragm. Now let's delve deeper into what that really means. Picture your diaphragm as this large, dome-shaped muscle that sits right below your lungs, acting as the superstar of your respiratory system, its primary role, helping you breathe. Now here's where the hiccup plot thickens. Every now and then, your diaphragm contracts suddenly and involuntarily. That's right. It throws a little muscle spasm party without even asking for your permission. When this happens, you take in a swift, unexpected gulp of air. But the story doesn't end there. This sudden rush of air into your lungs sets off another reaction. It causes your vocal cords, those tiny bands of muscle in your throat responsible for your voice, to snap shut. And when they do, they produce that familiar, sometimes embarrassing, hic sound. It's like an acoustic signal, announcing to the world that your diaphragm is having a bit of a moment. This entire process happens so quickly, it's over in less than a blink of an eye, often leaving us surprised and sometimes even a little annoyed. But remember, it's all part of being human. Our bodies are full of these wonderfully quirky mechanisms. So a hiccup is essentially a surprise party your body throws for you without your consent. It's unexpected, it's involuntary, but most importantly, it's a sign that your body is alive and kicking. But what exactly triggers these involuntary diaphragm spasms, you may ask? Well, there's an array of factors that can set off this little physical quirk. Eating too quickly is a common culprit. When we gobble down our food without taking a breather, we can swallow air, which might irritate the diaphragm and trigger hiccups. Similarly, consuming spicy foods or drinking carbonated beverages can also lead to a bout of hiccups. The capsaicin in spicy foods and the gas in fizzy drinks can both cause the diaphragm to contract uncontrollably. But it's not just physical factors that can start a hiccuping spree. Emotional triggers such as stress and excitement can also play a role. When we're feeling intense emotions, our bodies can react in unexpected ways, and yes, that includes hiccups. So, the next time you're at a thrilling party, remember, those hiccups could just be your body joining in the fun. But the big question remains, why do we hiccup? There are several theories out there that attempt to answer this puzzling question. Some researchers suggest that hiccups might be a vestige from our evolutionary past. The rhythmic contractions could have helped our amphibian ancestors pump water out of their gills. Another theory proposes that hiccups are the body's way of getting rid of excess air trapped in the stomach, preventing bloating and discomfort. Yet another interesting theory points to the possibility that hiccups stimulate the muscles that aid in swallowing. This could explain why hiccups are common in newborns. They might be a mechanism to help them learn how to drink milk and swallow properly. While the exact reason remains a mystery, it's clear that hiccups are more than just a simple annoyance. They're a fascinating glimpse into the inner workings of our bodies.